So dear students, in previous lecture you studied about the pathophysiology of diabetes mellitus and along with that diagnosis of diabetes mellitus in urine. Now in this lecture we will study blood test for diabetes mellitus along with other tests, and then we'll see how to manage diabetes mellitus. So blood test involves various tests. First is random blood glucose level, which measures the blood glucose level other than postprandial stage or fasting. So it can be done any time of the day. And if it is above 11.1 millimole, which is 200 milligram per deciliter, it is considered as diabetic. So in this case, it is It is done by a glucometer, which is having a sensor to check the glucose, and this instrument has two parts. One is having lancet kind of feature, which pricks the finger, and the blood oozes out, and that blood droplet is checked by the glucometer. So it can be done anywhere and any time of the day. Second test is fasting plasma glucose, which is done to check the concentration of glucose after 12-hour fasting. So in the morning, you can do it. So if the person is having glucose concentration less than 80 mg per deciliter, then it is hypoglycemic. And if it is between 80 to 110 milligram per deciliter, the person is normal. And if it is between 110 to 126 milligram per deciliter, then it is pre-diabetic, and this kind of glucose level is called as impaired fasting glucose. While if it is more than 126 milligram per deciliter, the person is hyperglycemic or diabetic. Next test is oral glucose tolerance test, which is done in patients to check the management of glucose, whether they are able to internalize the glucose in their cells or not. So there are different conditions for doing this. The person is advised to have unrestricted carbohydrate diet for 3 days before coming for the test, and before test should not have eaten anything before 8 hours. And when you go to the hospital, first blood sample is withdrawn, and then after that you've been given 75 gram of glucose in 300 ml of water, and this solution you have to consume in 5 minutes. And after that you have to wait for 2 hours, and then your blood sample will be withdrawn. So this is done to measure the plasma glucose before and 2 hours after the glucose load. So you can compare in this table, fasting 0 minute before taking the glucose solution. In non-diabetic patients, it is 110 milligram per deciliter, while in diabetic, it is 126 milligram per deciliter. And impaired glucose tolerance is between 110 and 126. While after 2 hours, it should be, in normal people, it should be around 140 milligram per deciliter, while in diabetic patient, it is more than 200 milligram per deciliter. While in impaired glucose tolerance or pre-diabetic condition, it is between the 140 to 200 mg per deciliter. So in this glucose tolerance test, you are required not to have anything before 8 hours. And then in the hospital, your first sample will be withdrawn, and you are advised to take this 25 milligram per deciliter glucose solution. And then your sample will be withdrawn after 2 hours of the test. And then this graph is made between the glucose concentration and the time of the sample withdrawing. So it can be like you can give the sample after 1 hour also, then 2 hours, and in measuring this curve, the sample can be withdrawn after 3 hours, 4 hours, and 5 hours also. So in normal people, this when they take the glucose, their glucose concentration increases after 1 hour, and then it goes down to after 2 hours. While in diabetic patient, it is already high, and when they take the glucose concentration, it is even higher. And when after 2 hours, like, it is not going down, it is almost at the same level, and it takes a lot of time to get down. and still it is little higher than the normal blood glucose concentration. Oral glucose tolerance results can be analyzed. People without diabetes who have fasting value under 6 millimole per liter 2 hours under 7.8 millimole per liter. People with impaired glucose tolerance, they have fasting value of 6 to 7 millimole per liter, while at 2 hours they have 7.9 to 11.0 millimole per liter. While diabetic level is fasting value before test is over 7 millimole per liter, while after 2 hours it is over 11.0 millimole per liter. Next test is glycosylated hemoglobin, which is to measure the glycated hemoglobin proportion, which indicates the glycemic condition. So in this case, what happens? Hemoglobin is glycosylated, and this can reflect the glycemic control of the patient over 2 to 3 months. So for every 1% increase of the HbA1c indicate the 35 mg per deciliter increase of blood glucose level. So in this case, when blood glucose levels are elevated for prolonged period of time, glucose attaches to the hemoglobin in red blood cells to form glycated hemoglobin, which are often called hemoglobin 1AC. And the longer hyperglycemia occurs, the more glucose binds to hemoglobin. And once hemoglobin is glycated, it remains that way for the life of the cell. Therefore, buildup of glycated hemoglobin in a red blood cell reflects the average glucose concentration to which the cell has been exposed during its life cycle. Because the average lifespan of RBC is about 120 days and individual cells have varying lifespans, the glycated hemoglobin test is used mainly to assess average blood glucose concentration for the previous 3 months and can provide a diagnosis test for diabetes mellitus or an assessment test of glycemic control in people with diabetes. For every 1% increase of the HbA1c or glycated hemoglobin, it indicates the 35 milligram per deciliter. And glycated hemoglobin reference ranges between 4.5% to 6.5%, which is measured by chromatography, in which blood sample is loaded, and then if it is checked for the migration of the glycated hemoglobin. If it is glycated, then it will be heavier and it will be going downward. And if it is normal, then it will remain at the other upper level. So this way they non-glycated and this is glycated, so they can be measured. And reference rate is 4.5% to 6.5% percent of normal hemoglobin. So out of 100 gram hemoglobin or 100 milligram hemoglobin, out 4.5 or 6.5 milligram hemoglobin glycated is glycated, that is normal. And if it is increasing beyond this, then you can give the value, interpret the value, like for 1% increase, there will be 35 milligram per deciliter of increase. So this can be taken by this uh, table. Like if it is 6%, then the concentration of blood glucose is 135. And if it is 7, then 170. If it is 8, then it is 205. It is 9, 240. This way, by 35 milligram per deciliter, it increases. So WHO diabetes diagnostic criteria, which depends on the GTT as well as glycated hemoglobin. So condition is like after 2 hours, how much glucose is there after taking that glucose solution, and fasting glucose concentration, and glycated hemoglobin. How much? 7.8 millimole per liter or less than 140 millimole per mg per deciliter, while fasting glucose is uh, below 7.1 or 110, and glycated hemoglobin is 42 millimole per mole, and percentage is 6%. While diabetic patients have more than 200 mg per deciliter, and fasting glucose is 126 milligram per deciliter, and glycated hemoglobin is more than 48 millimole per mole. while percentage is more than or equal to 6.5. Fructosamine test, which is again similar kind of test in which glycosylated plasma protein, specifically albumin, are measured. And this has advantage over glycated hemoglobin that it can be done at the 2-3 weeks of interval, while glycated hemoglobin can be measured after 2-3 months. And it can be done specifically in the patient which who have history of hemoglobinopathies or anemia, so their hemoglobin is already less to be measured. And in this case, the glycation occurs at the at the albumin, and then it converts into its ketone counterpart. Diagnosis of complication of diabetes. So if diabetic condition is severe, there can be other symptoms like lower limbs which show peripheral pulses, tendon reflexes, and they show high sensitivity to vibration, light touch, or proprioception, while their feet will have callus development, nails will be deformed, and they need podiatry, and they have ulcer and a deformity which is nephropathy or related to urine related disorders. Diagnosis of diabetic nephropathy, which is done by measuring the microalbumin in the urine. In normal people, albumin excretion is around 30 milligram per day, while in patients with kidney damage, it is more than 300 milligram per day. In diabetic nephropathy, it is in between of these two conditions, which is between 30 to 300 milligram per day, and this condition is called as microalbuminuria. Diagnosis of diabetic retinopathy, which is done to check the visual or vision in the diabetic patients by visual acuities, ophthalmoscopy, and digital photography. Management, if the diabetes has happened, then what procedure, what precaution a person has to take. First, it has to change the lifestyle. They have to take good nutritious food, and they have to do regular exercise, and apart from that they have to control their diet to maintain the blood pressure.